We had a visit from the Standing Committee of the National Assembly, which is Committee on Appropriations, led by Musimaimane. It was good to have the committee. There are quite a number of things that they've picked up, but even before the visit, we had our own presentation that we did with them, because we had to indicate what is it that we've been doing in the province in terms of assisting our patients. But their key concern is the area of medical legal, which we gave them a briefing on how far are we with medical legal in the province. We have dropped from where we come from in terms of rents. Now we're sitting at 13 billion on medical legal, which has been audited by AG.
I think it was an important oversight to be on, to be able to see the 4 institutions we were able to go to. That gave us a fair sample of a Department of Health that is working hard with limited resources, but clearly faces some challenges. Part of the challenges is obviously, as the population of Gauteng is growing, it is influencing the patient population in healthcare. Secondly, the ratio of medical practitioners relative to patients is become an issue that's become strained. It is clear that there's some significant innovation on certain sides. Take Baragwanath as an example. I think as a committee we were impressed with some of the initiatives that are coming on board, the improvement in theatre equipment, etc. Overall, I think it's important to note that the MEC is doing her job and working hard, and so is the team in the Department of Health. It does, though, mean that the chronic nature of medical legal claims is going to be something that is going to be with us for a while. It's quite clear that the resources are being stretched in the province.
Previously, we weren't as busy a unit as we are now, but I think with population growth, what it is, we are suddenly overburdened. And I would say our number one resource is the staff that we feel, doctors and nurses, porters, it goes across the board.
I'm happy that at least the other issues is the issue of infrastructure that they've picked up, which we reported to them too. The issue of the staff capacity in our hospitals, especially the nurses, the cleaners, the porters, all those value chain that lead to the services that we must provide in the hospitals. The issue of records management, it's another issue that the committee have picked up, which we have plans on it, but we've started with that process of e-health, which means we're digitizing all the systems in the hospitals.
The job of this committee is to answer the question which says, how do we appropriate money for better infrastructure? How do we ease the burden on patient-doctor ratios? How do we hold accountability on digitization of records?
The importance of this visit is that whatever they've raised, I'm going to go and implement it. One of those, which is the staff capacity, that is frustrating everyone. People that are here can't work properly because the number of staff, it's not enough even in terms of the ratio that we're supposed to use. It's not fair, so that's why we have to make sure that we implement the recommendations that the committee is raising to us.